I just want to share a quick little implementation success story that I was grateful to be a part of. This was 5 community mental health agencies who were banded together and partnered with a public school system in Anne Arundel County, Maryland. They decided that they wanted to start this MBC journey together because they were working in the schools and wanted to be sure that they could clearly communicate to the school system the importance of their mental health services, but they also had a dual why, which was they wanted their clinicians to have these data for themselves to be able to adjust students' treatment. What I'm showing you on this slide is that this may be a multi-year process for you. So, at the very beginning, we were just identifying goals, talking about the why. We had a number of stakeholder interviews, conversations about different measures, and we were testing on a really small scale with champion clinicians who said, yeah, I'm willing to try measures with, 3 kids on my caseload. And we did that for the first school year before the initial system-wide training. And then in that year two, we had clinician feedback surveys and some booster training. And all the while, the agency leadership were reviewing the implementation data. And then in the third year, we started heading towards sustainability, thinking about turnover and retraining. On the next slide, I'm just bragging a little bit about their outcomes, and they were able to see moderate to large effect sizes, which actually exceeds some of those we see in the published literature for child psychotherapy, which is just so incredibly exciting. They were also able to disaggregate this, not showed on the slide, but by grade band, and learn some interesting things and provide additional professional development around grade bands that clinicians were saying they needed some more support with. But we did see good outcomes, and we were not looking at these aggregate outcomes until after 2 years. So if you're one of those agencies where you have a dual purpose of aggregate outcomes in MBC, I know Sandy and I could probably have a whole separate breakout on this topic, but if you are going to aggregate these data, please, please, please don't do it right away in implementation. Do it with a lot of caution. And then like our final comments here, just in terms of implementation lessons learned on the next slide, is that your leadership certainly matters a ton. Many of you on this call are leaders, and that's why you're here, as well as the teamwork being such an important piece of this. We want to be listening from the bottom up, meaning our clinicians on the front line and the recipients of these measures, just the same way we do with measurement-based care practice. We want to apply a lot of those same principles to our measurement-based care implementation. We want to empower shareholders, find and elevate those champions, celebrate them, start small, and know your why.